Hey everybody, Dave Eling with the Muskegon County Department of Veterans Affairs, and we're doing another segment of Veterans Did You Know? And today we're down into hospice. You've probably been downtown and gone down Terrace and Muskegon Avenue. It's already tore up down here, but you can't miss it. We're just stone's throw away from Burger King over here. And it's the hospice. It's the Mercy Visiting Nurses Center and Hospice Center for this community, for Muskegon. And we're going to do a little talking today, and with me is Moni Franks, and Moni is the
manager of the hospice.
And people say, well, what are you doing about veterans in the hospice? Well, you know, veterans decide what you think. You're all going to die, every one of us. We're all going to die. And so hopefully at the end of life, you are in a situation where you're cared for, you're looked after, you're not forgotten, you receive the care and dignity that you need to. And this is what's important hospices are. And a lot of people have misconceptions about what a hospice really does or doesn't do, and they have to come in the last couple of days or something. That's not so. That's not necessarily so. So, Moni, thanks for having me down, by the way, and coming down and stuff. And tell me what you guys do. What do you do, and what is your focus? What is your services?
Well, let me tell you a little bit about hospice. You know, I just want to kind of bounce off the comment you made about when you're at the end of life, you know, being able to get support. I often say to people when I'm talking about hospice that, you know, you've been able to choose your medical specialties all through your medical career history. You know, you've been able to have a pediatrician and maybe a cardiologist if needed, or an orthopedic surgeon if you have a bone injury. And really, it's very important for you to choose hospice, which is the end-of-life specialty. We are specially trained to be able to help people, and especially veterans who are facing, you know, very challenging issues at the end of their life. We do provide hospice services in the home. It's provided by a team of providers led by our medical director, Dr. Dick Camps, who's a surgeon here in town, as well as being the first hospice and palliative care certified physician. He leads the team, and then there's a very comprehensive team of nurses, social workers, spiritual care coordinators. We have counselors specially trained in grief and loss. Home health aides are able to go to the home, as well as volunteers. And we actually have a special veterans support volunteer program where we have veterans that will go out to the home of other veterans as a volunteer and just be there for them to be able to talk through and understand what they've been through. So.
Yeah, I know one of your veterans, Steve Allen, is a personal. We grew up together, graduated from high school together. He told me he was coming down and going with this course. I said, well, good for you. This is something you should do. You can give back and listen. And you know, a lot of times, you know, as veterans, we always say they won't talk to anybody else unless it's another vet, because you won't understand if I try to talk you. You know, and sometimes at the end of life, or when you're getting there. Sometimes it's just a comforting thing that know that you recognize that military service. Some guys don't want to remember it. Want to totally forget it if they can, but others, it's such a poignant part of their life. And I tell people, if you went in the military, I don't think there's anything you can do for 1 or 2 or 3 year stretch that has such a profound impact on the rest of your life as serving in the military.
Absolutely.
I mean, it's just horrendous, especially if you're unfortunate enough to have the war be going on, and then doubly unfortunate enough to have go over there to it, and then what happens with you. And it's really cool that you guys go out to the house. I don't think a lot of people realize. They think, well, if it's hospice, I got to go to a building and then that's where it is, you know. But can I stay in my house as long as I can? Can I stay around my family? Can I, you know, the things that surround me? And I know anybody that I've known who's had a family member in hospice of any kind, they said it's the best thing in the world for the family support. I mean, it's a difficult and it's a trying time because nobody wants to face that, or nobody wants to say this is it. But you want it to be on your terms as much as possible.
Absolutely.
And I think old vets are the same way. They kind of just want to have, they want to be in control to the very end if they can. And then you guys give them the opportunity to do that.
Well, you know, with hospice, it's interesting because it's really the first time in a medical care history that the patient and the significant others, family members, are the ones that really choose the plan of care. We work very closely with the patient and their significant others to say, what is it that you want the end of your life to look like? The primary thing we do is make sure that all their symptoms, pain, nausea, shortness of breath are taken care of, so then we can really look at the emotional and the spiritual things, or maybe what are the things that are undone in your life that you'd really like to accomplish. And the team is specially trained to be able to work together to provide that kind of support. And we do. We provide care in wherever a patient calls home. It could be their home, it could be a family member's home, a friend. It could actually be, a veterans facility. It could be, a nursing home, an assisted living. So I think, the key piece here is that we meet the patient and family where they are. We work with them to develop a very individualized plan of care that really focuses on how are you going to be able to have the highest quality of life, receive the most peace and serenity at the end of your life, and die peacefully in the place and in the arms of the people that you're comfortable with and that love you. So,
well, is there again, hospice is nothing. Is there a time frame? I've heard people say within a year if you've been diagnosed, or 6 months, or 3 months, or a month. Is there a time frame when hospice will come in and or should be called in or should be notified or whatever?
I'm so glad that you asked that, because I think that folks have a perception that hospice is really for the last few days or maybe few weeks of life. Really, the ideal is for a person to come in with months to live, because they're still active. We want the folks that are still getting out and playing cards with their friends, and we want folks that are still able to get to the grocery store, and we help them to achieve that level of physical comfort, and then we're able to really talk with them about what would you like to do at the end of your life. We recently sent somebody to the casino, and we worked as a team to make sure that the oxygen and the medications and everything was set. We recently took a veteran and had him go fishing out at the Muskegon Pier, and he and his family members and friends, and we had our veteran volunteer there, and he's recently passed away, but in a book that he wrote, we also work on life stories, and he had a book written about his life. He mentions just how meaningful some of these last things that he wanted to do, maybe one more time, and they were so important to do. So I think you've brought up a couple of really good points. We work with the patients and the families. It's a medical specialty that is paid to care for the patient and the family. We meet folks where they live, wherever that may be, and we really individualize the plan of care. How do you want the end of your life to, how do you want that to look? We want to give people the option to stay in their home and not have to die in a very lonely hospital bed, or in a hospital bed where there's lots of equipment and lots of tubes and it's just not personal. We'd rather have folks in their home where they're comfortable and, as you mentioned, surrounded by the things that mean so much to them.
But does that require a diagnosis?
Yes.
Terminal diagnosis?
Yes, it does.
So whether it be...
Yes.
6 months, 12 months, or whatever, there is a time frame?
There is. The 6-month time frame, and
okay.
I'm sorry I wasn't as specific as I should have been there. Under the payment rules for insurance, a person has to be diagnosed as having a terminal illness that will cause their death within 6 months. And the person also has to decide to stop all aggressive treatment. And so if you've been receiving chemotherapy to treat your cancer, and either the doctor says it's no longer effective, or the patient just can't tolerate it any longer and stops, then they would be qualified to come into hospice. So we don't pay for the aggressive treatment. We do pay for the comfort treatment after a person has stopped that care. And we work with the veteran doctor, the doctor from the veterans home, and our medical director to decide that diagnosis, and then we move forward with serving the patient with hospice services under that diagnosis.
Well, I had a very good friend about 2 years ago passed away, and a Vietnam vet, Agent Orange exposure cancer. Diagnosis, he thought he'd fight it, I'm tough, I'll take the chemo, and a little while on the chemo, he decided, this is not a quality of life that I want. I don't want this. And he had the bucket list, the list you're talking about. He said, there's things I still want to do, and when I take this chemo, I'm sick, I can't do anything. He said, this is not how I want to go. So he stopped all medication, and he said, this is on my terms. So I want to pick up with this a little bit more. We're going to take a quick break here, and we'll come back, and we'll follow up on that thought. So stay tuned. We'll be right back with you.